How can I get rid of my jowls? It's important to understand what's actually going on here is not necessarily an increase in the size of the jowl, but rather a repositioning of the fat pad. There is a central cheek fat pad that runs down the lateral aspect of your face, which is usually supported by the ligaments at the mandible and the nasolabial fold ligament, and by a more lateral cheek fat pad that blends that fat pad in so that it forms one structure. As you lose volume or weight as you get older, this fat pad will rotate forwards and down. What would I do? It's usually more common that patients with a jowl actually have a smaller chin because they notice it much sooner than the patients who have a stronger chin. So a weak chin and a strong jowl means you can strengthen the chin, which will give you the first and easiest win in the battle against the jowl defining the face. The second opportunity which you may have is to support the jowl more laterally and superiorly. The ideal situation is that the patient has small and atrophied cheeks with almost a bony contour with all that you can see. This you'll see often in 55-year-old women who have maintained their weight well but are slim. They have a very dominant cheek fat pad and almost nothing behind it. So if you replace all of the volume behind with a dermal filler and then build the structure up both laterally and underneath the zygoma, you have a reasonable chance of creating a little bit of support that pulls the jowl ever so slightly backwards.